Hi, I'm Mency Vargas,
And I'm Natalie Stella.
and we did a presentation on tuberculosis.
Tuberculosis, you may ask?
Tuberculosis is also known as Mycobacterium tuberculosis. This is a bacteria that affects one's lungs very harshly, although it can affect also your kidneys, your spine, and other places. How does tuberculosis enter the body, Nat?
Well, it's actually entered through the air. So if a person coughs, sneezes, you can actually get the disease. So what does the pathogen do to one's body?
The pathogen mostly attacks one's respiratory system, making you cough, throw up blood in some cases, and overall just shuts it down. When you have TB, it may not become active until months or sometimes even years later because it is such a slow growing disease in one's body and tissue that it disguises itself sometimes. So you may not even know you have tuberculosis until after those couple years.
How does the pathogen invade one's immune system?
Well, tuberculosis produces a cell envelope called glycolipids that are antagonists of a macrophage receptor named TLR2. This is dedicated to the recognition of pathogens, whereby preventing its efficient recognition by the immune system. So what are the symptoms of tuberculosis, you may ask?
So tuberculosis consists of prolonged coughing, chest pain, feeling tired or weak, loss of appetite, weight loss, poor growth in children, fever, coughing of blood, night sweats, shortness of breath, and back pain.
These are just some of the examples of what can be caused by TB, but in some cases, there are more deeper issues that cause death, like the bacteria eating away at your tissue, because since it's there for so long and expanding for about 12 to 32 weeks, it can overall just kill you very, very slowly.
So my friend, do you know anyone who encountered tuberculosis?
Actually, this woman, Jackie, actually encountered it when she was in her mid-20s. She at first thought it was a severe cold that she was having because she was coughing, but then that coughing turned into dizziness and having headaches and all overall having nausea. So her aunt, who was a medical professional, told her that she should go to urgent care and get tested for several things. After these several tests, she found out that she had tuberculosis. With the help of the health department, she overall just stuck to her procedures, her medication, and over the period of about 10 months, her tuberculosis was gone. So how has this changed over time with damages and how it is now?
Well, since half the time people don't know that they have tuberculosis, it's not very treated as fast as it should be, so it has adapted to the host's resources and taken advantage.
Okay, so it uses our body against us.
Yes, basically.
Okay. This adapts to its metabolism in order to evade the host's immune system, adapting to things that are attacking it in order for it to go away. They're using these methods to survive and establish a successful active or latent infection. So what are the treatments used for TB or to get rid of TB?
TB disease is treated with a standard of 6-month course of 4 antimicrobial drugs.
So about half a year just to get rid of it?
Yes, about half a year.
Oh my goodness.
And that is provided with information, supervision, and support to the patient by a health worker or a trained volunteer. The vast majority of TB cases can be cured when medicines are provided and taken properly.
So this disease is so severe that it takes either half a year or more in order just to get rid of it.
So you may ask where TB is located, and that is at Sub-Saharan Africa, Eastern Europe, and Asia.
There is a vaccine for TB called the BCG vaccine, but this is not mandatory. Mostly here in the US, it is not common at all. It is used in other countries on younger kids that get TB or where TB is more common. So this vaccine is not mandatory here in the US. Here in the US, it is more common to use the medications to get rid of this TB within that 6 to 12 month period. So these are some myths and facts about TB itself.
A total of 1.6 million people died from TB in 2021.
About 1/4 of the world's population now is infected with tuberculosis bacteria.
TB is a leading killer of people with HIV.
Multi-drug resistant TB currently remains a public health crisis and a health security threat. It is currently the 9th top reason for people's death in the world.
Thank you.